Kick-ass facts, even more outdated and crazy-ass medical procedures. Pew, 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 pew! Hold on to your taints for this one. Ancient Greek, Roman, Persian, and Hindu texts refer to a procedure known as lithotomy for removing bladder stones. The patient would lay on their back, feet apart, while a blade passed into the bladder through the perineum, the soft bit of flesh between the sex organ and the anus, your taint. Surgeons inserted their fingers or surgical instruments into the rectum or urethra to assist with the removal of the stone. Just fucking keep the stone there, man. It was an intensely painful procedure with a mortality rate of about 50%. Once used to treat severe mental illness, lobotomies involve severing connections in the brain's prefrontal cortex. The problem is, we need the prefrontal cortex. It's kind of a big deal. A Portuguese neurologist invented the procedure in 1935. A year later, Walter Freeman brought the procedure to the United States. He drove around the country in his lobotomobile, performing the procedure on thousands of patients. He used an ice pick, which he would hammer in through the corner of the eye socket using a mallet, and then jiggle the ice pick around. Patients were not anesthetized, rather they were in an induced seizure. The procedure often led to severe side effects and has been replaced by more effective and humane psychiatric treatments. The surgery fell out of favor by the 1950s, but only after ruining thousands of lives. In 1747, Robert James, an 18th century English physician, invented and patented his famous Dr. James fever powder. He claimed his concoction could treat any number of ailments, including fever, scurvy, and even distemper in animals. He was notoriously secretive about his recipe. As it turned out, the secret ingredient was antimony if you're American, a toxic metal. Antimony was believed to work as a cure-all for any number of ailments, including fever and gout, mainly for the simple reason that it made people vomit. In the 18th century, doctors believed that purging was a sign that the body was ridding itself of toxins and restoring itself to a natural, healthy state. However, inducing vomiting by ingesting poison generally did more harm than good. Arsenic is an ancient medicine dating all the way back to Hippocrates. It was used to treat fevers, headaches, ulcers, syphilis, psoriasis, sleeping sickness, asthma, heartburn, and leukemia. In 1786, Dr. Thomas Fowler manufactured his own arsenic-based remedy and began bottling and selling it under the name of Fowler's Solution, and it was sold through the 20th century. Before condoms were a thing, ancient Egyptians would use animal dung, specifically crocodile and elephant, as their contraceptive of choice. The dry dung would be inserted into the vagine to act as a barrier. Other similar contraceptives during this time included lemon halves, tree sap, sea sponges, wool, and cotton. Later, you may be familiar with Lysol, a powerful corrosive cleaning product that's covered in warnings not to touch it with your bare skin, but in the 1930s, Lysol was marketed as a feminine hygiene douche. Feminine hygiene was code for birth control, which was illegal at the time. Lysol failed miserably at being a feminine cleanser and as a birth control, but that didn't stop Lysol from telling women it was gentle and safe to squirt a ton of it inside themselves. Insulin shock was a form of psychiatric treatment in the 1920s in which patients were repeatedly injected with large doses of insulin, which sent them into daily comas over several weeks, and treatments could last up to 2 years. This was mainly used to treat schizophrenia from the 1930s to the 1950s before neuroleptic drugs were introduced in the 1960s. What are you supposed to do when a large percentage of your population is addicted to morphine? Introduce heroin, of course. In the late 1880s, heroin was introduced as a safe and non-addictive substitute for morphine, finding it to be 5 times more effective and supposedly less addictive than morphine. Bayer began advertising a heroin-laced aspirin in 1898, which they marketed towards children suffering from sore throats, coughs, and colds. Some bottles depicted children eagerly reaching out for the medicine while moms give their kids heroin on a spoon. Doctors started to have an inkling that heroin may not be as non-addictive as it seemed when patients kept coming back for bottle after bottle after bottle. Despite the pushback from physicians and stories about heroin side effects piling up, Bayer continued to market their product until 1913. 11 years later, the FDA banned heroin altogether.